Washington spent a lifetime turning Medicaid into just another government handout. Fraud was rampant while taxpayers picked up the tab. It was unsustainable, and Democrats knew it. President Trump has changed that. His One Big Beautiful Bill put the program back on track. States can no longer game the system, abuse is being rooted out, and work requirements are now a reality. Leading this turnaround is CMS Administrator Dr. Mehmet Oz. After a career in medicine and television, he's now focused on making Medicaid more sustainable and restoring dignity to millions of Americans. His message is clear. Medicaid should be a hand up, not a hand out. As Dr. Oz puts it, you can't be a wealthy country if you're not a healthy country. So, Dr. Oz, we all know you. You become a household name, really, and you had so much going on. We really saw things kind of change for you in 2022, though. You decided to get into the world of politics. So take me back for a minute at that decision and really talk about how it changed your life, because I think things kind of started to change after that for you.
I've always been in the change business. In heart surgery, I love doing the operations and taking care of patients, but I kept thinking, how can we change the way we do our operations? The TV show, which you've been on, was primarily about getting people to change their thoughts about what they thought they could do in their life. So by getting the message across that you win the battle for health in your kitchen, your living room, your bedroom, it changed minds, and all of a sudden we saw people get empowered. For me, politics was an obvious next step, because if you really want to change the country for the better, you have to get involved where decisions are being made. Instead of complaining about it, you might as well roll your sleeves up, get in the ring, and start fighting for what you think matters. And that's what 2022 taught me. It wasn't the outcome that I desired, but I learned a lot about how people within policy and politics start making decisions that shape the country. And I also learned a lot about President Trump. Going through the last couple of years, how much pressure there was on him to not do the right thing, and how he was going to be strong in the face of that adversity. And that makes him a mentor to a lot of us serving in the administration now. And I think it's seen here at Health and Human Services, where Bobby Kennedy is a spectacular and brave leader who wants us to work together. Marty, Jay, me, he wants us collaborating to find ways we can reach across agencies, get out of the silos that have historically existed, and fix the problems that are plaguing America. You don't just make America healthy again by getting people to eat better, but you have to get them to feel they have power about their future and start to act on it.
You say being the administrator for the Center of Medicare and Medicaid is the best job you've ever had. Why?
This is the best job I've ever had, and I've had some great ones. But here at CMS, I'm surrounded by thousands and thousands of extraordinarily bright, mission-aligned people who are passionate about making sure healthcare works better for the American people. And every decision I have in this office changes how billions of dollars are spent in order to incentivize the right behavior, to get beneficiaries, people, Americans, incentivized to do the right thing for themselves, empower them to take action. But it also changes how doctors and hospitals, insurance companies, and all these guys work together. And it's hard to take some of these steps because people don't like it when you mess with the bottom line, their bottom line. But our bottom line is the American people. And with the support from the President and Secretary Kennedy, every single day, for me anyway, is a journey into a wonderful world.
There are a lot of people out there who were told that they should be concerned about losing access to Medicaid because of the One Big Beautiful Bill. Maybe you can give the truth to the American people. What is the reality of the situation with that?
This is a program that over the last several years during COVID dramatically changed from what it was originally created to do 60 years ago. When you walked into the entranceway of this building, there's a plaque on the left that Hubert Humphrey gave a quote for, and it says, "It is the moral obligation of government to take care of those at the dawn of life, the children, those at the twilight of life, the seniors, the mature, elderly, and those living in the shadows." It is tough to take care of people who are vulnerable. But every great society does it, and we're great people, and we're going to do that. That's the focus. Somehow the system, it slipped, right? Through drift or maybe by design, it became a very different program over the last several years. We wanted to put the clock back to where it was before COVID, when the program was viable, when it was working. And the president was very clear. He wanted to cut the fraud, the waste, and the abuse out. The abuse happened to a large extent because there were these mechanisms to pay states extra money, so they weren't responsible for their own actions. It was basically legalized money laundering. But there's also this phenomenon of able-bodied people being on Medicaid. So we decided to push hard, the president was very supportive of this, on getting Americans back to work by encouraging folks who are able-bodied on Medicaid to go volunteer, get an education, work more hours, just do stuff that shows you're engaged with your fellow man. I think it takes people out of the trap of being stuck in Medicaid, and it also allows them to move up the ladder, get jobs, make more money, get out of poverty, and begin to feel more pride in what they're achieving in life.
Well, you've talked about partnering potentially with technology companies to cut the waste and fraud in the Medicare system and kind of bring it into the 21st century. It's really not there yet. So how can you do that? What is the plan there?
The idea that we would use information to advance and improve healthcare is one that everyone should be wondering, well, why hasn't it already happened? You own, Laura, your own medical records. They're yours. You paid for them. Yet we never have made it clear to you how you get access to it. So now that you know you own your medical records, you can protect them and put them away safely so no one can see them, or you're going to have the option within the next few months to take those medical records and share them as you wish with your doctor, with the hospital, a clinic, or with an app that's making a solution to help you with a problem that you're worried about. So we're going to create an ecosystem, but it only works if the information within healthcare is shared. President Trump passed rules in the first administration to let this happen. It all got shut down in the last couple of years. We're doing what 2025 would mandate, taking the best tools we have available, and every major technology company's gotten involved in this. They're going to make it easier for you to get smarter about yourself. It empowers you, and to me, that's the ultimate Maha move. We're doing to healthcare what's already happened across the world in other areas. It's about time we do it for the American people.
I think I know the first time you met President Trump, but maybe you can tell us the story. I believe it was you were having an event and you wanted to do it at one of his golf courses. But do you remember the first time you met?
Of course. I'm so happy. I can't even talk about it. I'm surprised you remember it. We have a kids foundation. It's about 20 years old, and we had just started it. So this program needed to have some big launch event, and we needed a golf course. So I approached the president. This is, again, 20 years ago. He was just a successful businessman at Mar-a-Lago. And I said, you don't know me from Adam, but I'm trying to do something that helps teens. And I need your golf course to get all these celebrities to come, because they'll come for you. And he looked at me, and he said, is it for teens, as you say? And I said, yes, it all goes to teens. He goes, take it. I said, well, how do I pay you? He says, no fee. Just take the golf course, do the right thing. Wow. That's the first time I met him. And there's a lot more to love than that, but that's a good start.
Yeah. Would you have ever imagined back then that Donald Trump would one day be president and that you would be working as part of his administration?
I think you know there's a God when you realize that dots that started being drawn 20 years ago might eventually create lines that lead to where we are today. I think even a year ago, there are many who were wondering what was going to happen. But I think the first 8 months of this administration show what passion and love can do for a country. I hear it all the time as I walk around. You know, folks are appreciative that we're trying to do the right thing and taking on big challenges, especially in healthcare, where there are probably 150 people who make all the decisions that matter, and some of them have their own interests at heart, and some of them have forgotten why they went into healthcare, which is to take care of other individuals. But the sanctity of life, the beauty of being able to take care of your fellow man, it buzzes here, it resonates here for every single person at CMS, and makes me very proud to be part of this team.
Just to finish, you know, you've had such an incredible career. I feel like you've been part of all of our lives for so long. What is it you want to one day, when people talk about Dr. Mehmet Oz, what do you want them to talk about?
I want my legacy to be that I changed the system to work better for the American people. No longer were they the last thought on the itemized list of things to do. They were number one, and they always should be. It's a great gift to be able to give health to others. I want to make sure that people in this agency know that every single day, and we deliver for you, the American people.
Want even more Fox News on YouTube? Become a Fox News Patriot today. Click join to find out how.